When we think about having children, our focus is often on love, timing, stability, and dreams. Rarely do we think about something as seemingly small as blood types. But what if I told you that this small detail can have very real consequences for your future baby's health? Not in every case, and not something to fear, but something to be aware of. Especially if you want to empower yourself to make the best possible decisions for your family's well-being. Most people know their blood type in passing, ABB or O, but fewer people understand the R factor, the positive or negative part that follows. And this is where things start to matter. When a woman with Rh negative blood becomes pregnant with a baby from an Rh positive father, a type of incompatibility can occur that puts the baby at risk. It's called hemolytic disease of the newborn, or HDN. Now, this doesn't happen in every case, but when it does, it can be serious, potentially leading to anemia, brain damage, jaundice, or even stillbirth if untreated. But here's the good news. This condition is preventable. In fact, in the UK, the NHS has very specific protocols to address this exact issue. A simple blood test during early pregnancy can determine the AIR status of the mother. If she is negative, a doctor's monitor carefully. At around 28 weeks, and sometimes after birth, an injection called anti-D immunoglobulin is given to protect against future risk. It's safe, it's effective, and it can save lives. This is not about creating panic. This is about encouraging knowledge. So many couples step into pregnancy with no understanding of their combined genetic or blood health, and unfortunately, the result can be devastating. This is especially true in communities where cousin marriages are common, where genetic overlap can increase the risk of inherited disorders, and where blood compatibility is often completely overlooked. Disability in a child is never anyone's fault, and so often it is something no one could have predicted or prevented. But in this case, knowledge truly is power. Talking to your GP, getting your blood group tested, having those pre-pregnancy discussions with your partner. These aren't dramatic acts. They are deeply loving ones. When you take the time to understand how your body and your partner's body work together, biologically and emotionally, you're not just preparing for a baby, you're laying the foundation for a safe, conscious, and healthy beginning. And that's what every child deserves. Not perfection, but awareness, intention, and love at the root of their very first breath. Blood types are often considered just a medical detail, a minor fact checked during emergencies or when donating blood. But when it comes to pregnancy, your blood type, specifically your R factor, can have profound implications on your baby's health. While most people are familiar with the basic blood groups like AB, and O, far fewer understand the significance of the positive or negative symbol that follows. That tiny detail, whether you are R positive or negative, can create compatibility or conflict between a mother and her unborn child, and in certain situations, it can lead to serious complications. In most cases, blood type incompatibility between partners is not a problem. However, when an AR negative mother carries an R positive baby, usually inherited from an R positive father, her immune system can mistakenly identify the baby's blood as a threat. During the pregnancy or childbirth, especially if some of the baby's blood cells enter the mother's bloodstream, her body may begin to produce antibodies against Rh positive blood. The first baby is typically unaffected, as the immune response tends to be slow at first. But in future pregnancies, if the mother has developed these antibodies and carries another H positive child, her immune system can attack the baby's red blood cells. This immune attack can result in hemolytic disease of the newborn HDN, a condition that can lead to anemia, jaundice, brain damage, or even fetal death in severe cases. The troubling part is that many women do not know their AR status before becoming pregnant. This lack of knowledge can lead to unmonitored pregnancies, especially when there is limited access to preconception care or when pregnancies are unplanned. The mother may have no symptoms that indicate an issue, and the baby's distress can escalate without any visible warning signs until the situation becomes critical. This is why the R factor is so vital to check early, ideally before or in the very first weeks of pregnancy. A simple blood test can confirm a woman's R status and determine whether closer monitoring or preventative action is needed. In the United Kingdom, NHS protocols have been designed to catch this early and offer effective prevention. The standard approach is to screen all pregnant women for blood type and R factor. If a woman is R negative, further monitoring follows. She will be offered anti-D immunoglobulin, a protective injection given at around 28 weeks of pregnancy, and sometimes again after delivery, to prevent her immune system from producing harmful antibodies. This not only protects the current pregnancy, but also reduces the risk of complications in any future pregnancies. Understanding how your R status and your partners may interact is not just about biology. It's about responsibility, awareness, and proactive healthcare. It's a way to safeguard your child's first experience of life, even before they take their first breath. Too often, conversations about pregnancy focus only on excitement and hope. But this quiet detail, blood type, deserves space in the discussion because its impact can be life-altering. In the United Kingdom, the National Health Service (NHS) has implemented clear, evidence-based guidelines to identify and manage blood group compatibility during pregnancy, especially focusing on R incompatibility between mother and baby. This system of early intervention, routine screening, and preventive treatment is a powerful example of how modern healthcare can protect both maternal and fetal well-being. Despite the seriousness of potential outcomes related to R incompatibility, such as hemolytic disease of the newborn (HDN), these risks can be dramatically reduced when the NHS protocol is followed with diligence and understanding. From the moment a pregnancy is confirmed, a woman under NHS care is offered a series of antenatal blood tests. One of the very first and most critical checks involves determining her blood group and R status. If she is R negative, further steps are automatically triggered to protect her and her baby. It's a structured approach, not reactive but preventative in nature, grounded in years of medical research and clinical observation. The beauty of this system lies in its simplicity and accessibility. Through a single blood test, the NHS is able to identify a potential risk and create a plan to avoid harm altogether. That's not just medicine. It's proactive, compassionate healthcare. If the mother is H negative, and especially if the baby's father is R positive, there is a risk that the baby will inherit the R positive status during pregnancy or at birth. If any of the baby's blood crosses into the mother's bloodstream, her body may recognize it as foreign and start to produce antibodies against R-positive cells. These antibodies don't usually affect the first pregnancy, but they can cause serious complications in any future R-positive pregnancies. This is where the NHS steps in with a solution that is both effective and widely available: the anti-D immunoglobulin injection. The anti-D injection is a type of passive immunization. It works by clearing any R-positive fetal blood cells from the mother's bloodstream before her immune system has a chance to react and form lasting antibodies. The NHS typically administers this injection around the 28th week of pregnancy, and sometimes a second dose is offered within 72 hours after childbirth if the baby is confirmed to be R-positive. Additional doses may also be given if there is any incident that increases the chance of fetal blood mixing with the mother's, such as abdominal trauma, miscarriage, or certain prenatal procedures. This structured timeline ensures that protection is consistently in place. It allows mothers to continue future pregnancies with far less worry about immune complications, which could otherwise result in anemia, organ damage, or even stillbirth for the child. The entire process is safe for both mother and baby. Side effects are minimal, and the benefits far outweigh the risks. More importantly, the NHS offers this intervention free of cost to eligible women, removing the barrier of affordability from an otherwise life-saving treatment. In addition to the injection itself, NHS care includes ongoing monitoring. Negative mothers may undergo additional blood tests to ensure no sensitization has occurred. In rare cases where antibodies have already been produced, more intensive fetal monitoring may be necessary. These pregnancies are managed carefully with ultrasound, Doppler studies to assess fetal anemia, and sometimes even intrauterine transfusions if the baby's condition becomes critical. The medical system is prepared not only to prevent problems, but also to manage them effectively if they arise. This approach has turned what could be a devastating risk into a manageable condition. Decades ago, R incompatibility was a leading cause of newborn illness and death. Today, in the UK and other countries with strong prenatal care programs, the number of cases has drastically dropped. That progress is not by accident. It is the result of standardized screening, timely intervention, and widespread awareness. But awareness is still key. While the system is in place, it only works when women attend their prenatal appointments, follow up on their test results, and accept the recommended treatments. Misinformation, cultural hesitation, or simple unawareness can all be barriers to receiving the full benefit of NHS care. Public health efforts continue to focus on educating women, particularly in high-risk communities or among first-time mothers who may not be familiar with the importance of H screening. Language support, culturally sensitive communication, and clear explanations from healthcare providers all play a role in making sure no mother slips through the cracks. Additionally, encouraging partners to understand their own blood type can further clarify the baby's possible R status and allow couples to participate together in planning their child's health journey from the very beginning. What stands out most about the NHS system is that it doesn't wait for problems to appear. It acts early. It's a model of preventative care that empowers women and builds confidence in their pregnancies. It replaces uncertainty with understanding and offers real tools to navigate a risk that many would otherwise overlook. For many women, knowing that a simple injection can eliminate a lifelong health challenge for their baby is not just reassuring. It's life-changing. In that sense, these guidelines do more than just prevent disease. They promote peace of mind, a deeper connection to maternal health, and a stronger foundation for the baby's first chapter in life. There's a fine line between awareness and fear, especially when it comes to pregnancy and parenting. But when it comes to blood group incompatibility, especially R incompatibility, the focus should never be on creating fear. It should be about equipping parents with the knowledge they need to make informed decisions. Far too many couples enter parenthood without knowing even the basic details of how their blood types might interact, and that lack of awareness can lead to complications that were entirely preventable. Awareness is not just power, it's protection, especially in a system like the UK where resources and guidance are available, but only effective if people know to seek them out. One of the biggest obstacles to prevention is the assumption that pregnancy is a natural process that doesn't require medical knowledge unless something goes wrong. That mindset can be dangerous because certain complications, like R sensitization, give no warning signs until it's too late. It's not something you can feel happening inside your body. It's silent, hidden, and often only detected through early blood testing. And yet, this silence is what makes awareness so important. If expecting parents understand the basics of blood compatibility and know their R status before or early in pregnancy, they can easily prevent risks that otherwise might impact not just one child, but all future pregnancies. It becomes even more critical in communities where cousin marriages or close relative unions are culturally common. These couples may share more genetic material, which can increase the risk of inherited conditions. When combined with R mismatch and lack of prenatal care, the risks compound. Education in these cases must be clear, sensitive, and respectful. It's not about changing traditions, it's about working within them to promote health and protect the next generation. There is no blame in not knowing something you were never taught. But once the information is in your hands, the power shifts. You have the ability to act, to ask questions, and to protect your baby before birth even begins. Knowing your R status, talking to your doctor, and understanding the role of anti-D treatment isn't complicated or costly in the UK. It's a routine part of care. But routine doesn't mean optional. Awareness is the doorway to prevention, and prevention is the most compassionate form of care we can offer our future children. When two people decide to start a family, they often focus on love, timing, financial readiness, and emotional connection. But part of true readiness, part of creating a safe and healthy future for a child, also means understanding how your biology aligns with your partner's. This doesn't mean obsessing over medical charts or fearing complications, but rather stepping into parenthood with clarity and intention. Knowing something as basic as your blood type and your partner's is one of the most loving and responsible steps you can take. It doesn't just help you feel more prepared, it can actually protect your baby from preventable harm. Having a conversation about blood compatibility may seem small or even awkward to some couples, but in reality it opens a door to deeper intimacy and mutual care. You're not just thinking about your relationship anymore. You're considering how your bodies might work together to bring new life into the world. That shift, from romantic connection to conscious co-creation, is a powerful one. It means taking shared responsibility for the health of your child, starting before conception ever happens. It means asking important questions like, what's your blood type? And Have you ever had a full health screening? Not out of paranoia, but out of love. Within the UK's healthcare system, there is ample opportunity to act on this knowledge. General practitioners and antenatal clinics are equipped to run blood tests, offer counseling, and provide preventive treatment like anti-D injections when needed. But it starts with the decision to engage, to ask, to prepare. When both partners are informed and involved, the process becomes smoother and more emotionally grounded. It's not just the mother's responsibility. It's a shared journey, and it begins with shared awareness. This kind of conscious planning doesn't guarantee perfection, but it builds a much stronger foundation. It allows parents to approach pregnancy with confidence, not confusion. And it teaches a powerful messaging that health isn't just something we respond to, it's something we actively shape. Every small act of preparation, every honest conversation, every moment of education lays the groundwork for a more secure and loving future. That's what it means to build a sexually and reproductively healthy relationship. It's more than desire. It's devotion to something bigger than yourselves. Understanding the impact of blood group compatibility, particularly Rh factor, is not just a medical formality. It's a vital part of responsible, conscious parenthood. With the right knowledge and timely action, risks like hemolytic disease of the newborn can be almost entirely prevented. The NHS has created a clear path to safeguard both mother and baby, but that protection only works when couples choose to engage with the process. From early screening to simple injections, the tools are already in place. What's needed is awareness, communication, and the willingness to prioritize health before problems arise. When you take the time to learn about your body, talk openly with your partner, and work with your healthcare provider, you're not only preventing complications, you're creating a loving, informed foundation for your child's life. Because nothing says love like being prepared before the first heartbeat even begins.